Next we can see the functional assessment. The functional assessment is the measure of the patient's ability to complete the functional tasks and fulfill the social roles, specifically addressing a patient's ability to complete tasks ranging from simple tasks, that means the self-care, to higher level activities. The purpose of the functional assessment that include the functional assessment that is essential in the care of elderly patients because it offers a systematic approach to assess the elderly persons for any deficits that commonly usually undetected. Then helps the nurse to identify the problems of the patient and utilize appropriate measures to solve that problems. Then it provides a way to assess the progress and decline over time. Helps the nurse evaluate the safety of the patient's ability to live alone. The functional status includes evaluation of the sensory changes, ability to complete the activities of daily living, and gait problems, balance problems, elimination problems, nutritional problems, all included. Then we can see about the instruments to measure the functional ability of a person. The functional status may be assessed by several methods: self-report, direct observation of the patient, direct observation by the family members of then direct observation method is a best choice if it is possible. Then instrument chosen should be based on specific goal or purpose for the evaluation. For example, if the focus is on the basic self-care and mobility, a Barthel index should be used for this symbol as a symbol index tool. The CARDS index for activities of daily living and instrumental activities of daily living is another rating scale for measuring the functional ability. There are three instruments. First one is Barthel index, second one is CARDS index for activities of daily living, and third one, instrumental activities of daily living, is another instrument. Then the performance measure such as another scale, that is Trinity gait and balance measure or chair rise test, can be used to evaluate a higher level of functioning of the person. Now we can see the psychosocial aspects of aging. First, psychological aspects of aging. Among that we can see the cognitive aspect. And that cognitive aspect, memory first. As you all know, once the person become old, there is memory lost, and that create many problems there in the family also. The short-term memory deteriorates with age. Long-term memory does not show similar changes. There is differences in short-term memory, decreases in short-term memory. Then a well-educated and mentally active person does not exhibit such changes in a faster rate. Then that the education is having some influence over the memory loss. The time record for memory scanning is longer for both recent and remote recall among older adults. This can be attributed to social or health issues. That is attributed to health and social issues means the person is having stress or fatigue or illness that can affect the memory functioning of a person. But it can also occur with certain physiological changes due to aging. That means decreased blood, if there is decreased blood supply to brain, means that can interfere the center of the brain controlling the memory function, and that leads to memory loss. Next we can think about the intellectual functioning. What will happen for intellectual functioning? The fluid abilities, that means the ability to solve the problems, problem solving, novel problem solving abilities, that tend to decline from adult period to old age. Higher degree of regularity in intellectual function present on most of the old age people. Intellectual abilities of the older people do not decline but do become obsolete. Then their formal educational experiences, that is reflected in their intellectual performance. If they are well educated, means the declining intellectual capacity is less compared to others. Now we can think about the learning ability of a person. The ability to learn, that may not decline by age. Or we are thinking like that the ability to learn will decline. But the solving of that reaction time with age and over arousal of central nervous system are noted in old age. If there is something to learn, new learning is there, means that the study shows that there is arousal of the central nervous system. It may lead to lower level of performance in tasks which require high efficiency. Those tasks which require high efficiency, they need more time to learn. Then ability to learn continues throughout the life, although that is strongly influenced by personal interest and preferences. At the age of 80 also they can have some degrees that may the ability that shows their interest is influencing the ability to learn. Then accuracy of performances diminishes with age. Even though they are learning new things, there are chances for mistakes. Then next we can think about the loss and grief reactions. By the time once the individual reaches the age 60 to 70 years, they might have experiencing many losses in their life that may lead to mourning and that may lead to grief. The loss of the loved ones, the loss of the spouse, the loss of job, retirement, these all are some losses in their life. It is impossible for some of the older age people to complete the grief process in response to one loss before other loss occurs. Once loss means finished, means the next one comes. That's why they may not be getting adequate time to complete their grief process. Because the grief cumulative, this can result in bereavement overload. The patient is expressing the bereavement overload. This can further predispose to which condition? Depression. This is about the loss and grief. Next, the mode of attachment to others. Think about the attachment to others. The need for attachment is consistent throughout the lifespan. The attachment is consistent. Attachment to their children, attachment to their parents or their funds, that is consistent throughout their life. Well-being of senior citizens can be contributed to socialization and companionship. See, they wish to continue their companionship and they wish to have adequate socialization in their life. Then next thing about how they are dealing with death and death anxiety. Death anxiety, sure, the old age person, they are experiencing the death anxiety. This is more, sometimes we are considering it as a myth also, or it's a reality. Still it's not clear if the person is having death anxiety or what. The feeling of abandonment, pain and loss may lead to fear or anxiety in many of the old age persons. Suppose they are having some serious illness or they are suffering from some lifestyle diseases. Sometimes they may not be accomplished their goals in their life. That time the death anxiety will increase. Next, think about the psychiatric disorders. This is a time for high risk for emotional distress in old age persons. Later life constitute a time for especially high risk of emotional distresses. The common problems, psychiatric problems that we can observe in old age are dementia, then delirium, then another disorder is depressive disorders, then the most common disorder is sleep disorders. This is most common psychiatric illness as what we can observe in old age category. Next, we can think about the psychosocial assessment of old age persons. Psychosocial assessment, we know the tool. What is the tool? The mental status examination tool. Altered mental status we are assessing. Assessment of the cognitive function to detect the altered status that involves an examination of the memory, perception, communication, orientation, calculation, comprehension, problem solving, thought processor, language, visual and spatial abilities, abstraction, attention, aphasia, apraxia. This all we are measuring. The assessment that can be facilitated by the use of cognitive screening tools. A commonly utilized instrument is the Mini Mental Status Examination MMSE tool. The MMSE is a 30-point cognitive screening instrument that assesses the orientation to time and place, registration and recall, calculation, language skills, and visual and spatial abilities, and the above mentioned points. Then another cognitive screening instrument that is a mini cog examination tool, which is composed of 3-item recall and a clock drawing test, CDT test. I am not discussing about in detail about these all scales, because in psychiatry you are studying about these scales and all. The assessment of altered mental status or behavior may elicit criteria that lead to a diagnosis of dementia. It is essential to differentiate dementia from delirium. That is very important. Anyway, some more psychiatric problems are there. Alzheimer's disease, psychiatric-related Parkinson's disease and all. That also we must consider. Then next we can see about the emotional and affective status of the elderly persons. Considering the emotional and affective status, the characteristics include the first one about the depression. We can think depression that may occur for the first time in our older age and has been related to many changes that occur in their life. The independence of one's children, independence of one's own children, that's why then they are expecting about the reality of their retirement. Then their independence of children means they are becoming independent, the children, then they are not depending their parents as late. Then the loss of roles in the family, means they might have the father role, mother role and all, and means then the same way they have got a child role. Once they lose their parents means they are missing that child role. The same way means the death of the blood relatives, that means brother or sister, that also creates some role changes for that person. Then the death of the spouse, again there is change in role. Then the loss of roles, then again income. There is loss of income due to retirement or due to the loss of job, there is loss of income. Then the loss of spouse, loss of friends, loss of the family members, the loss of own homes, the loss of their pet animals, then loss of the functional ability, loss of their health status and ability to participate in leisure activities. There is many losses in their life. These all losses that can lead to depression for the persons. Then the society is giving an ageist message for them, and means more respecting them, not involving them in activities of daily living or social events. That also create some type of loneliness and some type of depression for the persons. Then the depression may also caused by some underlying illness such as Parkinson's disease or some underlying illness, brain disorders or degenerative disorders. The same way it may be due to some use of some drugs, usually difficult to identify why the person is getting depressed, why the person is depressed. Then even though many younger people also we are observing depression. Then once we are suspecting that the older person he is having depression, you have to formulate some information in order to assess the depression of that elderly person. That means whether the person is complaining of insomnia, whether the person is having weight loss, any anorexia is there, any constipation is there. Then these all are some vegetative symptoms of depression, we can say. Then they may be preoccupied with their past experiences. That is another symptom which shows depression. Then decreases in concentration, decreases in memory, and they are not able to take proper decisions. That is, decision making capacity that is going, pseudo dementia syndromes are there for the persons. Then other somatic complaints include decreased appetite, then they may be complaining of some musculoskeletal aches and pains, sometimes they may complain of chest pain, sometimes they may be complaints of fatigue. Then this all shows that we can't differentiate whether it's due to actual disease or it's due to depression. Then history of chronic illness or other health problems. Then think about the current medications. Then you have to compare all these things together and can find out whether the person is suffering from depression or not. Then you can assess or evaluate the depression using the geriatric depression scale as a screening tool. The geriatric depression scale. Another problem is suicide. This is sometimes associated with the depression. We are maybe from the newspaper and you can see the news like that the older person they are committing suicide with the suicidal tendencies. If they are living at their home and they are experiencing grief, they are experiencing that type of loss, sometimes they may think about this suicide. Then the pain is underdetected sometimes and the person is having some diseases like cancer. They may not be able to cooperate with the regimen treatment, and that time also the suicidal ideas will come in their mind. Then if the person is having these ideas, you should be very careful and have to watch the person, otherwise there is chances for committing suicide. Now we can think about the nursing and patient care considerations, nursing care considerations of elderly. Especially about depression and all. The treatment of depression that should be given to older adult and that include the drugs. The person is showing the symptoms, how to give drugs. Then you can encourage the patient to have some therapies, psychotherapy and some other modalities or counseling or guidance class or guidance that can help the person to recover from this particular condition. Then so we can provide some competent therapeutic measures for the patient to cope up with their life and to increase their self-esteem and they increase their self-worth. That means he can encourage the person to participate in meaningful activities in life. That means the person can engage in gardening or based on their general health. They can have many activities. Indoor activities or outdoor activities. The same way, help the patient to develop a sense of mastery over some task. Sometimes they may be depressed or they are agitated because they are not able to complete their task. Then so we can help the person how to develop mastery over some task. Then encourage the reminiscence of meaningful past events, how they have done the thing in the past. We are giving some positive encouragement for the persons and the person recalling their past events that will help to complete their difficult task. Then help the patient identify and use the social supports. So another important factor, the person is lacking social support. That means they may be living alone in their home. So we can encourage the patient how they can get adequate social support. And now there is advancement in technology, phone is there, internet is there, they can use encourage them to use these measures to improve their social support systems. Then the person is having some behavioral problems. So that is very common among the older adult. The behavioral problems like agitation, competitive behavior, irritability, getting anger. Consider these all things. This is due to aging process. There is changes in the brain. These are the psychological changes that will happen to the persons. The person who is looking after the patient, they must give some consideration for all these things. Then we can improve their mental status by using some alternative medical therapies like aromatherapy, pet therapy, music therapy. You can use some relaxation techniques, that means yoga, meditation. Then these these all alternative measures that will help the person to have a purposeful and very positive life. Then we can think about the motivation in elderly patients. What about the motivation? The characteristics that include the motivation is an important variable in the elderly patient's ability to recover from any disabling event and the ability to maintain his higher level of wellness. Motivation, how to motivate, the person must have the motivation to do like that. That is very important. Then it is possible to evaluate the patient's motivation to compare with the give treatment plan and adopt interventions to help to improve the elderly patient's motivation. There are some factors that influence the motivation in the elderly patient, that include a need or a hunger. If they are having a particular need, nobody is there to help, and that time, that's a motivation itself. Then a hunger, I want to achieve that thing, that's a hunger. Then that will motivate the elderly persons. Then the past experiences, specifically with health and care providers, that's another motivation. They might have doing like this, or I know how to tackle with that particular problem. Their experiences with the health providers. Then another is negative attitudes towards aging. Some persons, they are having some negative attitude towards aging. So how to motivate them? This is what is aging. This is a normal process that will help us to recover from all these type of bad thoughts. Then self efficiency expectations. So all having some expectations about the self efficiency, that I am able to complete this task, means efficient, my work is worth. That is the then, or the belief in one's own ability to perform a specific activity, whether I can or can't. That's the another confusion for the old age. That also motivation is having an important role in this particular step. Then outcome expectations, or belief that if a specific activity, if I am performing a specific activity, there will be an expected outcome is there. Am I able to achieve that outcome? That's their problem. There also motivation is important. Then the cost of performing a special activity in terms of time, money, pain, fatigue or fear. There's a cost of performing an activity. So if it's so costly, that means it will time consuming and create some pain, and income loss is there, then and means they hesitate to do that particular activity. There also come the importance of motivation. Then the internal factors such as sensory changes, cognitive status, and medications, the adverse effect of the disease condition and medications. These all factors that can influence the performance. There also the motivation is important. Then the external factors such as social norms, particularly if the norms conflict with the treatment and the influence of social supports. If the person is having not adequate support at home, the person is not means interested to perform some activities. Here also comes the importance of motivation. Then problems in motivation due to age-related differences, that includes a shift from achievement of motivation to a conservative motivation. There is a shift from achievement of motivation to a conservative motivation. So there is increased difficulty in establishment of rewards for elderly people due to their many losses. Again, there is a tendency to see a task as being more difficult than a younger person would. These all are some factors which are affecting their actual motivations. Then there is the person can use a tool that is of motivation wheel that can be used to evaluate the motivation in older adult. The motivation wheel. The motivation is influenced by beliefs about the physical and emotional benefits, mastery experiences, individualized care, social support and environment goals, physical sensations and new activities. Then this scale we are measuring these all activities. The motivation can be increased by strengthening the beliefs about the potential benefits, providing opportunities for mastery, identifying the individualized care approaches, and then the goal setting using social support, assessing supportive environment, then decreasing the unpleasant sensations and trying helping them to try new activities. These all can help to improve the motivation in adult. Then you can think about the nursing and patient care considerations. Establish a therapeutic relationship with the patient, even with the family members. Then encourage the patient to participate in all family activities. Encourage the patient to ventilate their feelings. Explore with the patients any indication for fear of other unpleasant sensation they are having associated with any activities. Then evaluate the scope of when the will to consider the many factors that influence motivation and implement interventions as appropriate. Then encourage the patient to verbally express their emotions. They must express their emotions freely. They have to express their anxiety, have to express their fear. Then examine the setting for the desired behavior to occur. Sometimes the environment may be very stressful, so how to modify the environment. Then attempt to use role models. Means we can refer the older person to some other person successfully completing their task. They are their role models. They can attempt to use these role models and they can improve their performances. Then ultimate, you must give advice that you do not be afraid of yourself. That is very important. Verbal encouragement and support is very essential factor in motivating the elderly. Then educate the older adult about the benefits of doing the activities, whether these are physical or psychological, whatever it may be. This is about the psychological aspects of this is all about the psychological aspects. Now we can see about the socio-cultural aspects of aging. Old age, that brings many important socially induced changes in a person. Some of these changes, they have the potential for negative effects on both the physical as well as the mental well-being of older persons. They want protection from hazards. Then they want the protection in doing all everyday their activities, normal task. They want to treat with respect and dignity throughout their life, and they want to die with respect and dignity also. In developing countries and Asian countries, usually the aged persons, they are awarded a positive honor. We are providing a positive honor for that persons that places emphasis on family cohesiveness. Then in industrialized countries, many negative stereotyped perspectives on aging still persisting. The age are always, they are thinking like that, the aging, that is age are always, they are tired and they are looking sick and they are slow in their movements, they are forgetful and isolated, they are lonely and unproductive. The myths are there. That's another societal view, social view. Then emplacement in one of the area where the aged faces the discrimination in all areas. Although the compulsory retirement have been eliminated, the discrimination still persists in hiring and promoting the aged employees. Retirement age is there. That's very crucial for that age, old age persons. The age of retirement is fixed 55 years or 56 years or like that. Then the status of elderly, that may improve with the time as the number of elder persons increases worldwide. Now we can see about the social activities and support assessment. Social activity assessment and support assessment. The social support for older adults, that is generally that is instrumental, informational or emotional. The social environment is important with regard to recovery of acute medical problems and management of chronic illnesses. Then elicit the information about the social aspects of the person by asking many questions. Can ask the person like that, how often do you socialize with others? How often you are going out, you are seeing your friends or companions? Then with whom you do you socialize? With whom? Means is your favorite place where you are going and with whom you are socializing? Then what type of activities do you get involved in? And you are doing some gardening, or you are interested in cooking, or you are going for jogging, what all activities you are interested? Then do you enjoy socializing actually? Then who can you call for help? And do you know of any church or community groups you can call for your help? And whether you are engaged in any community group or church group, means any spiritual support is there for you. These all are some questions you can ask to assess the social pattern of the elderly. Now the sexual aspects of aging that already discussed. There is many changes in females. The menopause begins any time during the age 40 to 50 years. So the gradual decline in the functioning of ovaries and subsequent reduction in the production of estrogen, the hormonal changes will come, and some physical changes can occur in the female. The symptoms are more likely to occur with their day-to-day performances in their activities. And there are changes in males that testosterone production declines gradually as the age increases. Then as a result of these hormonal changes, there is some physical changes can occur in the human being. Then this all about the system wise changes. Now we can see we see about the stress and coping in elderly. Stress means it's a state of mental tension and worry caused by problems in your life, work, and many other situations. Now coping means it's the process of contending with life difficulties in an effort to overcome or work through that difficulties. That is of coping, to overcome the difficulty or work through that difficulties. Now I think about some stress factors that already I discussed along with the psychological aspects. Still once more, the loss of social activities, threat to own mortality, loss of companions, loss of friends, that loss of peer contacts, then death of the friends, death of the loved ones, death of the spouse, the loss of purpose in life, loss of status, loss of authority, then loss of identity, loss of role, then loss of income. Then some major related changes affecting the psychological function of the person, the retirement, the move from friends, change in the neighborhood, then loss of space, then loss of dependency on others, then loss of helper, then the means stereotypes and myths, then age determined expectations and not able to fulfill that expectations, then negative attitude towards aging, then devaluation, self devaluation, then loss of money, then medication, overuse of the medications, sensory decline, functional impairments, chronic illnesses, then expression of symptoms in clinical manifestations, symptoms of clinical manifestations of mental illness or physical illness, then beliefs about the causes of mental health and mental illness, then some aspects of religion and not able to meet the religious activities, and spirituality, decline in spirituality, not able to pray. These all are some factors. That is all some losses, that all some stress factors affecting the person. In common, we can say the factors that may help to factors that influence the coping in older adult. The factors are that is the occurrence of several major life events in a short duration, one after the other. The events are coming, can be the losses or it can be threat A threat, it can be a threat or a painful event, one after the other it's coming. The occurrence of unanticipated events can occur. The death, the loss, the income loss, those all are unanticipated events. The narrow range of coping skills, the person is not having adequate coping skills. Due to the lack of coping skills, they may be using negative coping mechanisms to solve that particular problems instead of using positive coping mechanisms. Then lack of economic resources, even though they are having the positive coping skills, or if they are having adequate social support, if they are not having money, what they will do? The lack of money is an important factor. The economic resources, once the resources are there, they are able to cope up with the particular stress. The resources in the sense, it's not other resources are there, personal resources are there. Suppose a person is lacking, a person is having money, adequate money, and he is having some using some positive coping mechanisms, still the person is not having personal support. That means he is living alone, and even a servant is not there at home. That may create many problems for the persons. The person is not able to cope out with the stress. Then the weak social supports, means the person is isolated and living alone and not having any contact with others outside. That's another problem. If they are having some stress, they can't cope up with, they themselves, they are means having a painful experience and living at home. Then poor physical health, whatever it is there, our health, that's poor means have unhealthy means we are not able to cope up with the stress in our life. Then next what we can see, that is the factors that may help to re-establish coping. Is coping is negative means how we can re-establish coping, what all factors will help to re-establish the positive coping. That means first the person can renew the old friends. That's very important. They can find out their old friends and can assess the help from them. Then establish a new relationship. If you are sitting at home, nothing will happen. And if you are going out and establishing new relationship, it's very helpful. Then allow yourselves to grieve. Grieve appropriately. If grief is there, how to appropriately, how to undergo through the grieving process. You know about grief, how the person is undergoing through a grieving process. If there is a loss or there is a death, they can have positive mechanisms and can undergo through a positive grieving process. Then become involved with the meaningful volunteer activities. Simply sitting at home is boring. Actually, if they are engaging in volunteer activities, it helps to improve their health. Then develop new skills and coping strategies in their life. Some days the person may lost his some special skills. He can develop some new skills with the available means coping abilities, and with available resources they can develop some skills and strategies. Then appreciate the relief from responsibilities of home ownership. Sometimes once we are becoming old, our children, they may be carrying out the responsibilities at home. We should not think like that. We must have that means authority and responsibility. Just leave it and free from the responsibilities at home, the ownership of things, and only you should leave it. Then question any behaviors that are based on age determined expectations. Any behavior, if it is there, means it is against our expectations or age based expectations, if any doubt we can question it ourselves. Self questioning is important. Then challenge the myths. There are some myths that's prevalent in the society. How to challenge that myths and prove that is that all false informations. Then develop a firm self-identity. That's very important. You have to develop a self-identity in the society. Then adopt positive coping strategies. Keep mentally stimulated always. That's very important. Can read books, we can watch TVs, we can undergo some alternative therapies, whatever it may be, we should be always mentally stimulated. Then enroll in classes, there are educational programs, you must take the advantage from the educational opportunities, learn more and improve our mental status. Then spiritual well-being is needed, it's very important. When you go to the church or any other institutions, you can read religious books, and you can't means give time to pray. That way, how to spiritually you should maintain a well-being. That's very important, because the death anxiety is there. Means always we are thinking about our ultimate goal. We all are having an ultimate goal that depends upon the spirituality. So the spiritual well-being also very important. Then address the spiritual needs. If the in order to meet the spiritual well-being, how to address our spiritual needs. Means if you are not able to meet ourselves, you can get help from others to meet the spiritual needs. Then next is how to foster the social support, encourage the life review and remittance. That's very important. The persons, they are undergoing the same experience, how they are tackling the problems, how they are how they will be able to overcome that particular problems. That's very interesting, and that will give a positive force for us. We also able to solve the problems in our life. That's very important. The review of other person's life. Then can address role less, take less roles in our life. Means you've already taken many roles, then leave it and take less roles in our life. Then be flexible and calm. That's very important. Due to the all the aging process, we will be agitated, irritated, and we may get angry, whatever it may be. Pause for some time and be flexible and calm in all our activities and all our responses. Then be realistic. This is what is happening. This is due to old age process. Realistic and do like that and live like that. Do not be overly critical. Always we are critical means nobody will accept us. So be free and do not be always critical. Then share your feelings. That is very important. If you are having some unpleasant feelings, it's better you can share that and we can solve that problems. That's very essential. Then do not try to cope alone. That's a very important aspect. Most of the person, they are trying to cope alone. That create many problems. We may become depressed, diseased and all. So that's why do not try to cope alone. Can approach some counselors, or some you can get guidance from that counselors and all. Then adopt healthy lifestyle is very important. You can have some exercises, can have nutritious diet, and can adopt some leisure activities, even gardening, like that leisure activities. That means adopt healthy lifestyles. Then nutrition, exercises, meditation, hobbies. This all comes under the good health practices. Then use time for personal pursuits. That is very important. Then avoid bad habits. That also important. Due to this depression or any unpleasant events, some may have the tendency to adopt some bad habits like alcoholism, smoking and all. So it's better to avoid these bad habits. Then take one time, one task, one thing at a time. For there are many expectations are there, or if we have many tasks to complete, means it's very difficult for us to complete these tasks at a time. Take one task at a time and try to complete that task. That's important. Then have a sense of control over everything. That's very important. A sense of control. Then you have to control your emotions. Then enhance the self-esteem. That is the last measure we can take to improve ourselves. This all are about stress and coping in elderly. Now we can think about common health problems in elderly and the nursing management of that particular problems. First we can think about the mental health problems among older adult. Some problems we already discussed. Multiple social, psychological and biological factors that is determining the mental health of a person. That's why the person is suffering from biological problem or any social problems, so there is chance for having the psychiatric problems. We can think about the common psychiatric disorders, what we can see among the old age. The most important one is dementia. It's a syndrome in which there is deterioration in memory, thinking, behavior and ability to perform everyday activities. It's mainly affect older people, although it is not a normal part of aging. Another condition is depression. Depression can cause great sufferings and leads to an impaired functioning in daily life. Then unipolar depression that occurs in 7% of the general elder population, and it accounts for 5.7% of persons above 60 years of old. Depression is another problem. You all are studying about these problems in detail. I am not discussing in detail about these problems. Then delirium is there, then Alzheimer's disease is there, then some abuses are there. Then we can discuss in detail about the abuse. That is so psychosocial and sexual abuse of the elderly. Now about what is abuse. Elderly abuse, that is a general term that is used to describe certain types of harm to older persons. We are using some other terms to describe, mention this abuse. It's like that elderly mistreatment or senior abuse or abuse in later life or abuse of older adult, abuse of the woman or abuse of the older man or older woman. These all are the terms we are using to describe this abuse of elderly. Now we can think about the types of abuse. Among the abuse, the most important abuse, that's of physical abuse of the elderly, is very common nowadays. Even the newspapers we can read many news like that. The old Aji is getting abused by his drug addict child, like that. Many cases you can see in day to day newspaper. So physical abuse means the use of force that may result in bodily injury and physical pain or impairment in the older person, that is called physical abuse. The person is having pain or any physical force we are using and insulting the person, that is of physical abuse that can cause some impairment, that can lead to some pain, that is hitting, slapping, burning, pushing, restraining or giving too much medications or rather giving wrong medications. These all comes under the physical abuse. Consider an older person who is living in an old age home or living with the caretakers. The caretakers, they are not free because of this burden, the old age person burden. That's why what they will do, they will give some medications, sedative medications for the old age person. That's another harm, physical harm, over medication or wrong medications if they are providing. That's also comes under the physical harm. Next, about the sexual abuse. That is non-consensual sexual contact of any kind with an elderly person is called sexual abuse. That can be forcing a person to take part in any sexual activity without his or her consent. This can occur in any relationship, that is all sexual abuse. Even newspaper we can read about the rape, older Aji about 80 years is raped by a particular person or a drunkard. That type of news we can read from the newspapers. Then next one comes the emotional abuse. That is the infliction of anguish, pain or distress through verbal or non-verbal acts. That is called emotional abuse. That means shouting, swearing, frightening, blaming, ignoring and humiliating a person. This all comes under the emotional abuse. This is a usual thing happening there even though the older person is in home situation or halfway home situation or foster homes, wherever the person is, due to old age problems and due to their psychological instability, there is chance for some conflict in their house and there is chance for this type of emotional abuse. Next is neglect. Neglect means refusal or failure to fulfill any part of a person's obligations or duties to an elderly person. That means where a person is deprived of food, heat, or clothing, or comfort, or essential medication. What whatever it can be. Means there are some rights for a person to live in this world, the physical rights, psychological rights, social rights, and all these types of rights are there. That means right for means food, right for water, right for a house. These all are their rights. If we are neglecting the person and not providing food and not providing adequate clothing, not providing adequate shelter, or not giving means essential medications, these all comes under neglect. Then next is abandonment. Abandonment means desertion of an elderly person by an individual who has assumed the responsibility for providing care for that elder. The person who is responsible for providing care for the person, or by a person with the physical custody of the elder. Elder is staying with his daughter or son, or the elder is means caregiver is providing care for the elder. Whatever it may be, the elder person, there is a desertion of an elderly person by an individual who has assumed a responsibility for him. That is called abandonment. It's neglecting or not caring the person. Next comes the financial or material exploitation. That is another abuse. Financial or material exploitation. That's also very common. Means all are in behind of money, how to make money. That's the main intention of all human beings. That's why this exploitation means the illegal or unauthorized use of a person's property. Illegal use or unauthorized use without their permission. If you are utilizing their properties, what any type of economy, can be land or can be case of money, or in case of some properties, whatever it may be, that is a financial or material exploitation. Can be sometimes some are using the pension book and without their knowledge. Some are means taking their valuables from the old age persons without their knowledge. This all comes under financial or material exploitation. Now next is self-neglect. Self-neglect meaning the behavior of an elderly person that threatens his own health and safety. That's also very common. If the person is having depression or that type of negative attitude, they not hesitate to take food, they are not taking adequate rest, they are not taking adequate food, and they are not bothered about their personal hygiene. This all comes under comes under the self-neglect. And if they are not taking medications by themselves. Now the healthcare fraud and abuse, that means that is carried out by unethical health team members. That means they are giving wrong, sometimes they can give wrong medications, sometimes they can give over medications, or they are giving low grade care or low quality care they are providing, and means high amount of money they are receiving from the particular older person. These all are some health care fraud, and during surgery and all, more money they are taking from the persons, and some persons are having insurance claims and all. There are also some cheating can occur. This all comes under the healthcare fraud. An older person may either suffer from only one or two or these types of abuses, or different types of abuses at the same time. This is what is happening for the older person. Now the risk factors for the elder abuse and neglect. You can think about which all are the risk factors for elder abuse. This is a absence of close relatives, or they are staying alone. That's a risk factor. Then mental illness. The person is having dementia or depression. They are not aware of their day-to-day activities or their money matters and all that time. Others can cheat them. The mental illness. Then vulnerability of the person, whether it's agitated, irritated, and serious disease conditions are there. That time also there is chance for abuse, any types of abuse. Then older people, they are reluctant to admit to be abused or neglected. That is important. because they don't want to say something negative about their close relatives and all. That's why they are just suppressing everything, and the older person, they are reluctant to admit to being abused or neglected. The same way, the older person have less contact with the community. They are staying at home and they are not able to go out from the house. That's why they are not having like means adequate contact. They can't express their feelings or their negative aspects from the home. That's why that's unnoticed. The abuses are unnoticed. Then invisibility of the problem, that majority of the cases are not reported, that's important. Then cognitive impairment, if the person is having cognitive impairment, eyes, loss of eyesight or ear problems like that, then there is more chance for abuse. Then poor health is another factor. Then functional impairment is there, means can't work, can't get up from the bed, that's some functional impairment that may lead to some type of abuses. Then substance abuse, the person is using the substances, they are not aware of the surrounding, what is happening around them. Then dependence of abuse on victims, then there means the older person is having a grandchild who is a drug addict, so there is chances of some drug abuses. Then shared living arrangement, some old age homes or shared living arrangement, there is chances of many kinds of this type of abuse, especially neglect and all. Then social isolation, these all are some risk factors which leads to older abuse. Next, we can move to the physical health problems among older adult. While discussing about the physical health problems, by system wise we can see the physical health problems. Your medical subject classes, you already second year and this year you already covered almost all conditions. In system wise you covered the conditions, and the old age care related to particular condition also you studied. That's why I'm not going to discuss in detail about each condition, but I am mentioning which all are the common healthcare problems related to each system. First, we can see about the cardiovascular system. The common health problems in cardiovascular system include hypertension, ischemic heart disease, heart failure, peripheral vascular diseases, varicose veins, MI, some cardiac surgeries are there. Then these all are the main problems faced. Almost all cardiovascular conditions that's affecting the old age also, when cardiomyopathy all comes under this category. Then the nursing interventions to prevent this commonly include the person has to exercise regularly, how to follow proper diet pattern, base their activities, avoid smoking, avoid alcoholism, weight control is very important. Then avoid salt, extra salt, avoid fatty food, then check blood pressure regularly, regular health checkup is very important. Then participate in stress reduction activities, the regular medication is important. If the person is suffering from any types of these diseases, they can continue with the regular medications. It's all about the cardiovascular system. Now we can move to the respiratory system. The common health problems what we can observe among old age people related to respiratory system involved asthma, the bronchitis. This very common among the old age. The same way COPD, if there is a smoker or means sure that the person will have COPD. Then any obstructive pulmonary diseases can occur. Then dyspnea, breathlessness, chronic pneumonia is another important factor among old age groups. They can't means bring out the secretions, and also there is chance for pneumonia. The nursing interventions include encourage them to have adequate exercises. Then self protection is important. Deep breathing and coughing exercise they can practice. Then avoid smoking, take adequate diet, prevent pulmonary infections, frequent infections they have to avoid. That means they can means bathing, means they can take bath, means at the daytime they can use hot water for bath. The same way they must avoid excessive sweating and all. That was to prevent some infections, respiratory infections, upper respiratory tract infections that later leads to lower respiratory tract infections. So they must take some precautions. Then avoid crowding during this cold and flu season. Then wash hands frequently, take aseptic precautions. This all comes under nursing interventions. Some neurological and behavioral problems. The common neurological problems, that is Parkinson's disease, Alzheimer's disease, dementia, delirium, the same way cerebrovascular accident, stroke, that is one of the important neurology condition affecting the old age person. There is chance of disruption in the blood supply to the brain, and there is chance for itching. The same way aneurysm ruptures are there, and the person is having some type of hemorrhages. Then falls are there. Due to falls, there is chance for head injuries, accident, spinal cord injuries are there. Then along with the neurological problems, some psychological problem like sleep depression comes under neurology, anxiety disorders, the same way sleep disturbances. These all are the neurological problems faced by the old age category. The nursing interventions in general include advice for hospitalization if we recognize any neurological problems. Educate them about the early signs of neurological impairment. That of early signs of cardiovascular, cerebrovascular accidents, severe stroke. It's very important to teach them, educate them. These all are the signs. If they are having any numbness or any speech difficulty or any visual problems, they must go and they must consult the physician to find out any neurological impairment is there. Then teach all preventive techniques. That means the environmental safety is very important. If there is a chance that may lead to a head injury, that's why proper seating arrangement, proper chairs, proper bed, then side railing, then means about the care of the floor, care of the walls, and care of all environment, arrangement of the table, chair, and then their room, particular room. This is also very important in order to avoid accidental falls. Then encourage them to rise slowly from the bed, take adequate rest during daytime, then reduce the risk of falls at night. Also they must have adequate light at room to prevent accidents. This all comes under the neurological problems. Now next system is gastrointestinal system. Common health problems related to gastrointestinal system: problems with the speed, starting from problems with the chewing, problems with the swallowing. That means esophageal disease. So all problems are there. Swallowing difficulties there. Then coming to some ulcers, stomach ulcers. Then constipation is there. Colon gas problems are there. Then fecal impaction is there. Diarrhea is there. Constipation is there. Gastroesophageal reflux disease is there. Hernia problems are there. Then fecal incontinence is there. Then prolapsed rectum is another problem. Then anorexia, nausea, this all comes under gastrointestinal problems. Now the nursing interventions in general. Use ice chips, then mouthwash, brush your mouth properly. Cleanliness of the mouth is very important. Then eat in small quantities. Then frequent meals they can have. Eat high fiber, low fat diet. Use adequate vegetables and fruits. Then limit the use of laxatives. Toilet training means regular toilet programs. That means at the same time, if they want or not, they must go to the toilet that way. Then drink adequate fluid. Then for appropriate, if means that the person is having appetite, serve food in order to, sometimes the person may not have appetite, that time you have to serve the food attractively. The person is having some other systemic diseases, the food choices are less. Attractively in using different recipe, different way you can prepare and give food for the persons. Next, urinary system. The common health problems involved in urinary system is the renal insufficiency, urinary incontinence, urinary retention, then enlarged prostate, sexual dysfunction. Then this all comes under this urinary system. In the nursing interventions, regular supervision if necessary, ready to access to toilet, then drink adequate fluids, avoid bladder irritants like alcohol and caffeine, then practice pelvic floor muscle exercises, then maintain perineal hygiene, The skin should be clean and dry. Apply cream. Then clean underclothing. Advise them to use the clean underclothing. The same if needed. How to catheterize the patient also. Then the reproductive system complaints, breast cancer, cervical cancer, painful intercourse, vaginal bleeding, vaginal itching, then irritation, case of male prostate cancer, delayed erection. Nursing interventions include health and sexual counseling, advice about personal hygiene. Then musculoskeletal system, common health problems are Paget's disease, osteoporosis, osteomalacia, rheumatic diseases, rheumatoid arthritis, then spondylitis, complaints of back pain and joint pain, stiffness of the joint. Then very important factor is fall and fractures. That is very important. Then next, that foot pathology that will vary. Then there are some foot pathologies. The deviation of the fingers, deviation of the structure, normal structure of the foot. That can lead to falls. Then the nursing interventions involve the person has to exercise regularly, eat high calcium diet, limit phosphorus intake, then hormones and calcium supplementary may be prescribed if needed. Then vitamin D is important. Now about the special senses, that is vision, hearing, taste, smell and all. Already discussed general changes or normal changes taking place in these all aspects. Then cataract is problems are cataract, glaucoma, hearing loss, ear problems, use of hearing aids, then diminished smell, diminished taste, unusual smells, loss of taste buds. The nursing interventions include advise them to wear glasses, advise them to wear sunglasses, use adequate indoor lighting and use adequate night light, then use magnifier or reading glasses, use of large lettering to label the medications, then avoid night driving, advise hearing examinations, use of hearing aids, allow the individual to more time to adjust to the environment, use of gestures and object to help verbal communication, then speak slowly and clearly, avoid loud speaking, extra noises surrounding. These all are about the special senses. Next come to dermatology. That common dermatological health problems are pressure sores, herpes zoster, dermatitis, pruritus, and many other dermal conditions that can with the old age persons. Nursing interventions avoid excessive sun exposure, cold dress appropriately for temperature, cotton garments. You can suggest to use the cotton garments. Then maintain a safe indoor temperature. Bath 1 to 2 times daily. Then excessive use of soap should be avoided. Then apply cream or lubricant on the skin. These are the measures. Now we can see the health maintenance and prevention. The goal of the health maintenance and disease prevention is to add more quality years to life. There are 3 levels of health preventions are there. That is primary prevention, secondary prevention and tertiary prevention. The primary prevention is the prevention of disease before it occurs. Primary prevention can be broken down into, in old age cases, we can broken down into counseling, immunization, chemoprophylaxis. In 3 categories we can discuss about the primary prevention of old age. First the counseling. And means the old age persons, they need counseling. That's why you have to encourage the person to approach some counseling centers or counselors and to have counseling in order to solve their physical, psychological and social problems. That is, the counselor must encourage the smoke cessation, that is important. Then tobacco use, they have to discontinue their tobacco use. Then again counseling related to their physical activities. They must take adequate rest, they must take some exercises, then about their work pattern, then about counseling related to their sleep pattern. Then it's very important about the physical rehabilitation of the person, occupational rehabilitation, then This all comes under the counseling section. Then the counselor can identify the alcohol use, then abuse of the elderly. They only expose their feelings and their problems with the counselor. So the once the if they are going for a proper counseling, they can ventilate everything to the counselor. Then evaluate the death about the death anxiety, life expectations and all. This all can be done by a good counselor. Then some persons may have some dental problems, that also the counselor can give suggestions. Any health problems, suggestions also the counselor is giving suggestions. Then the alcohol abuse signs or symptoms are there. Then difficulty with the gait balance, good changing cognition, there is chance for accidents. This all the counselor can identify and give appropriate direction for the old age. That is primary prevention. First point is the counseling. The nurse can give counseling. They can approach a counselor and counselor can give counseling, or the clergyman or any close relatives or close friends, they can counsel the old persons regarding different aspects of their health, that is physical health, psychological health, social health, and some about their intellectual functioning, their spirituality. In all aspects they can solve their problems. Proper counseling is very important. Next is immunizations. There is more chance of getting many infections, that is immunization in the old age. You are not usually taking immunization during old age, but it's better you can have pneumococcal, there is chance for pneumonia, that's why influenza vaccines they can have. Then tetanus and diphtheria immunization, that is important. Then combined immunizations, tetanus, diphtheria, boosters are there for the persons. In our country, we are not following all these routines and all. It's better if you are following these immunization schedules and all. Then herpes zoster is a common condition. For that also they can be vaccinated. Next is chemoprophylaxis. That is another important primary prevention factor. Risks and benefits of oral anticoagulation therapy should be considered for older persons. Most of the persons are suffering from cardiovascular diseases and cardiovascular problems. So anticoagulation therapy management is important. Then some may have vascular diseases or fibrillation, so there is chances for cardiomyopathy, and it's better to use this as a prophylactic management. You can use the medications. Then another medication, calcium, vitamin D supplements, calcium supplement, so are very essential things, they must consider in order to prevent osteoporosis and all. Now the primary prevention, that is over. Now the secondary prevention is the detection of the disease in an early stage, commonly for many conditions, cancers, colorectal cancer, breast cancer, prostate cancer, uterine cancer, ovarian cancer, tuberculosis and tuberculosis. Many screening tests are available in our country. Health packages are there, health checkup is there, then insurance facilities there for the old age to have health checkup, and there is health package even in our India also there is, these facilities are available. Early screening, early detection is very important. Can undergo the screening test, they can go to the hospital and can undergo a health checkup. Even for the blood values, renal function, they can assess the liver function. It's better to assess the liver function, or cardiovascular system assessment they can do. This all comes under the secondary prevention. Then again comes breast cancer and mammography. It should be a routine assessment. They have to assess if any changes there in the breast. Mammography is important. Then they can undergo different types of ultrasound scanning in order to detect any problems. Then in order to detect if the person is having some memory loss, severe memory loss, and it's a sign of some brain damages. So CT, MRI, these all measures are available and they can undergo these all to avoid for early detection, in order to avoid further problems. The early stage itself is better to identify the conditions. Now move to the tertiary prevention. Tertiary prevention addresses the treatment of established disease to avoid the complications and to avoid the early death. The major areas focuses on older adult are preventing the complications of immobility, and another aspect is in tertiary prevention it comes the rehabilitation of the older adult. Preventing the complications of immobility means positioning is very important. Suppose the person is a bedridden person. The goal of the frequent position changes to prevent the bed sores, contractures, stimulate the circulation and prevent thrombophlebitis and pulmonary embolism, promote lung expansion and to prevent pneumonia or decrease the edema of the extremities. Changing position from lying to sitting several times a day can help to prevent change in the cardiovascular system. That's very important. So changing position is very important. Now the recommendation is to change body positions at least every 2 hours. Preferably more frequently in patients who have no spontaneous movement. Bedridden patient means how to change. It's better to change the position every half an hour. That can prevent all above mentioned problems. Then proper body alignment, maintenance of proper body alignments, dorsal or supine position. Held is in line with the supine both laterally and anterior posteriorly. That means the trunk is position so flexion of the hips is minimized to prevent hip contracture. The arms are flexed at the elbow with the hands resting against the lateral abdomen. The legs are extended in a neutral position with the toes pointed towards the ceiling. The heels are suspended in a space between the mattresses and the footboard to prevent the heel pressures. Then trochanter rolls are placed under the greater trochanters in the hip joint area to prevent hip problems. Then side lying or lateral positioning. In that positioning, the head is in the line with the spine, the body is in alignment and is not twisted. The uppermost hip joint is slightly forward and supported by a pillow in a position of slight abduction. The pillow supports the arm while which is flexed at both the elbow and shoulder joints. Now think about the prone position. The head is turned laterally and is in alignment with the rest of the body. The arms are abducted and externally rotated at the shoulder joint. The elbow are flexed. Then a small flat support is placed under the pelvis, extending from the level of the umbilicus to the upper third of the thigh. The lower extremities remain in neutral position. The toes are suspended over the edge of the mattress. These all are about the positioning. 3 positioning we discussed: the prone position, side lying or lateral position, and dorsal or supine position. Positioning we discussed. Now next about the therapeutic exercises. Discussing about exercises, it has been reported that there is a daily loss of 1% to 5%, 1% to 1.5% of initial strength in an immobilized older adult. So the goal of the therapeutic exercise is to develop and retain the deficit muscles to restore as much as normal movements as possible, to prevent deformity, to stimulate the functions of various organs and body systems, to build strength and endurance, and to promote relaxation. These all are the aims of exercises. Then how to perform passive range of motion ROM exercises, that is carried out without assistance from the patient. The purpose is to retain as much joint ROM as possible to maintain circulation. Then move the joints smoothly through its full range of motion. Do not push beyond the point of pain. Then perform the activities of assistive ROM is second point, carried out by the patient with the assistance of a nurse. The purpose is to encourage normal muscle function, support the distal part, and encourage the patient to take the joint actively through ROM. Then give only the amount of assistance necessary to accomplish the action. Now third category is encourage active ROM. that accomplished by the patient without assistance. The patient is doing himself. Purpose is to increase the muscle strength. When possible, active exercises should be done against gravity. Encourage the patient to move the joints through full ROM without assistance. Make sure that the patient does not substitute another joint movement for the instead. Then assist with resistive exercises, that is another thing, carried out by the patient working against resistance produced by either manual or mechanical means. The purpose is to increase the muscle strength. Encourage the patient to move the joints through its range of motion. Weight may be used and are attached at the distal point of the involved joint. The movement should be done smoothly. This about the exercises. Then again you can teach about isometric or muscle setting exercises. I am not going to discuss in detail about these all type of exercises. There are many category of exercises. The only thing with assistance the patient can perform, partial assistance the patient can perform exercise, and without any guide assistance the patient can perform the exercise. Now in tertiary prevention, the last point that comes, it's of rehabilitation. Rehabilitation I will be discussing in detail about the rehabilitation, but in short comes under tertiary prevention, geriatric rehabilitation and restorative care. The characteristics of rehabilitation: the primary goal is to restore the older adult maximum functional level. The multidisciplinary service involving input from the primary care provider, nursing personnel, physical, occupational, speech and recreational therapist, social worker, psychologist and dietitian. These all are the team members involved in the rehabilitation. Then the rehabilitation and restorative nursing involves developing a rehabilitation philosophy of care. That means the patient are encouraged and allowed sufficient time to perform as much their personal care as possible. The goals are set with the patient rather than for the patient. Participate the patient to in goal setting. That is very useful. That means the patient can schedule his activities and his timetable. Next, prevention of further impairment is important. Then focus on skin and wound care, regaining or maintaining bowel and bladder function, independent medication use, good nutritional status, psychosocial support, appropriate activity, rest, balance and patient and family education. These all are the main points comes under rehabilitation. Now the nurse and patient care considerations. The impaired cognitive function may have an impact on the quality of rehabilitation. If a poverty rehabilitation or patient is undergoing the rehabilitation phase, the cognitive ability is very important. Assess for physical problems that may exacerbate the cognitive dysfunction. Example, the infections that can then adverse drug effect, the metabolic and circulatory problems and fatigue. These all can affect the cognitive impairment. Provide innovative measures to encourage ambulation, active ROM and increase the function. Provide frequent verbal cues and large print reminders. Focus on basic self-care abilities and activities that are consistent with individuals' past experiences. Next, they implement appropriate safety measures such as bedside rails, proper lighting, appropriate staffing and avoidance of chemical and physical restraints. This is for the cognitive improvement. Then disability. That has got a tremendous impact on the patient's body image and that require an adjustment by the patient. Be aware of the stages of psychological reaction the patient may undergo if there is disability. That is, the period of confusion is there, period of disorganization is there, period of denial is there, period of depression, period of anxiety, period of grief, and period of adaptation and period of adjustment. This is the way the person is passing through a disability, from confusion to adjustment. So interventions in rehabilitation nursing include: provide an atmosphere of acceptance for the patient, identify and encourage positive coping patterns, encourage socialization and participation in group activities, give positive reinforcement and feedback about the progress, and involve families as much as possible. Then by all these interventions, it's better the patient can cope up with the disability. Then use suggested interventions to motivate or the older adult to engage in functional activities and exercises. Now we can think about community and home care considerations. Family or significant other caring for the older adult at home can have a major impact on the rehabilitation process. They are there with the patient all the time. They have in the community care or home care, they have a major role. Means assist the family or significant others to face the reality of patient's disability and to set appropriate and achievable goals. Involve the family or significant other in decision making and in about the patient care. That means the family members, they are with the patients. We can encourage the family members, use the appropriate actions, or before starting the actions, better we can involve the family members to participate in the decision making activities, how to plan the care and how they can cope up with the particular disability. Then then they can fulfill the rehabilitation goals. They have to get adequate practice and they have to develop their skills in order to take care of the patient and in order to participate in the rehabilitation program. Then help extend and alert the families or significant others skill by teaching the problems solving, treatment needs of the patients, ways to communicate the healthcare providers and use of community resources. How must teach the family members how to take care of the patient, how to solve a particular problem, how they can inform to the health resources, how they can get help from the health resources, how to contact a social worker, how to contact a psychologist or a counselor. These all information you must give to the family member. Then assess the level of caregiver fatigue and burnout syndrome. Burnout, it's very important. The caregiver, he is the person there with the patient, means a disabled person all the time. There is means he may have his own feelings, he may have his own physical problems, his social problems, psychological problems, is burning, and must take care of that caregiver too. For the older adult living independently, what we can do? Then suppose a person is living independently, encourage adherence to regular exercise programs which include aerobic exercises, stretching exercises and strengthening exercises, and means which helps to maintain an optimal health maintenance or optimal function. They can achieve an optimal function. Then the Center of Disease Control and Prevention, CDC, that recommends at all adults should accumulate at least 30 minutes of moderate intensity or physical activity. That means by walking, biking, swimming, they can engage in these type of activities or on 5 or more days per week. Older adult can meet the physical activity recommendations with the following criteria. That means they can undergo the aerobic exercises, moderate aerobic exercises 3 to 5 days, then flexibility, stretching exercises, then strength training exercises, then strength building exercises. These all are some exercise programs.